go to the moon in this decade and do the other thing, not because they are easy, but because they are hard.
We choose to do it, not because it's easy, but because it's hard. Our vision is within a decade, the trajectory of health will change.
Medicine is moving at such a fast pace right now.
Everything in medicine that we know now is going to change. Surgery, pharmaceuticals, well, now we're in the age of cells.
Cells will represent to doctors a much safer and more effective and sustainable way to treat all diseases that involve degeneration of tissue. So that's just about everything.
Exosomes will be very important in regenerative medicine because very similar to stem cells, they regenerate. They like to fix things.
That's what they do. They signal your tissues in your body to heal thyself.
Pope Benedict was very smart, and he really embraced science and how we can improve human health. The grand vision is to use cell therapy, stem cells, immuno-oncology using other cells of our immune system, natural killer cells, T cells, and then gene therapy.
What interested you about stem cells?
Oh, the technology is incredible. 15 years ago, I would have said this is science fiction stuff, and it's with us right now.
In vitro fertilization was considered a wacky idea. Now it's something that we use every day and we take it for granted. Soon we'll see the same thing with stem cell therapies.
It's a giant shift in thinking, in the concept of being a physician and a healer. And you can never just go back and say, I'm going to go back to my old life. I'll do surgeries and I'll write prescriptions. I can never do that again. I've already seen the other side.
5 years from now, majority of illnesses will be treated by stem cell, and any medical doctor coming out of any medical school must learn stem cell, otherwise they'll be left behind, period. We are a part of creating history.
Dr. Ed Tobenas here. We're sitting with Betsy one more time. Follow-up 8 weeks later from receiving her regenerative medicine cellular therapy with stem cell. And Betsy, I heard you were saying that your right shoulder is feeling great, almost like you forgot that you even heard it to begin with.
Yeah, it's like I've been doing a lot of stuff, and I actually was moving stuff from the moving storage.
Yeah.
And it occurred to me that it didn't even bother me. It's like it's just not in my head anymore.
Oh, excellent, excellent. And I was so excited. I know that's something that's been bothering you for a while now, you being a patient of ours here for a little bit. What I was most impressed with, you were mentioning you could raise your arm straight up and you have zero pain, right?
Yes.
Can you show us how it looks like there? Yeah, nothing. You sleep on it. You do nothing. You're 100% zero pain.
I could actually lift stuff further up now.
Yeah, I'm very, very impressed. And I remember you were stating that you were I don't know where I'm going with that, so I guess we'll get started. And I know we injected your shoulder, but you also mentioned that you were having chronic elbow pain, and now that's not bothering you at all.
Yes, I was about to go to the doctor. I had actually an appointment to have a cortisone shot done, and by the time the appointment came up, I didn't need it anymore, so I had to cancel it. And so far, I haven't had any problems with my elbows either.
That was very exciting. That's a great side effect to have, right? You know, having other pains go away as well too. Mm-hmm. Well, I'm very excited for you and the fact that you've got such great results. And 8 weeks later, still no pain and noticing improvement every day. I'm very happy for you.
Me too.
All right, excellent.
Hi, Dr. Ed Tobenas here. I'm with Betsy. I know you've met Betsy before from when she came in for her shoulder pain. She received regenerative medicine in the shoulder. She had such great results, started bowling, then went and got the knee done. She was having chronic knee pain for many years. She got the knee regenerative medicine in the knee. If I'm not mistaken, it was stem cells, right? Yeah. Both, right? And she's been so excited with the results and so functional that she actually picked up kickboxing. She's now kickboxing. Here, show me a couple of quick. Here. Look. Nice! I like it. So I have been so proud of Betsy. She has come such a long way. I've known her for many years. And the strength you have in your shoulder, I am impressed. I'm impressed. She's kicking now. I would ask you to show me the kick, but I don't know about that. I wanted to ask a couple of questions of Betsy when she was telling me she's doing all this. Betsy, are you having pain in the shoulder and knee?
No, the more I move, the more I use it, the better it feels. Yeah. And I'm getting the strength back. I'm getting back the strength on my shoulder, on my legs. And I'm losing weight at the same time, so.
So that's a great plus, right? You
Yeah.
know, that's now that you can be physical, you can do things, right? Your body can function the way it was meant to be functioning, which I know for years that was something that really bothered you. You couldn't really exercise, and you wanted to. I know in your line of work, you spend quite a bit of time sitting, right, and driving.
Yeah.
Where now you're doing so much more. A question I ask my patients when you get these great results: if you today you can go back to the yesterday you know,
Yes.
before you did the treatment, what would you have told yourself? I know there was always a level. Everyone always has their bit of doubt before they get the injection, right? Or any kind of therapy. What would you have told yourself?
Just do it. Don't think about it. Just do it. It's gonna work. I mean, I don't regret it, and I'm.
Is that the same message you would tell someone? Like they say if a friend was, kind of like, I don't know, should I, shouldn't I?
Yes, I do that, and I constantly say it to my brother too.
Mm-hmm.
So
yeah,
I do recommend it for everybody else out there.
Well, thank you very much. Thank you. But again, I've been so proud of you and how much you've gotten accomplished, and you really pushed yourself so hard, and you're accomplishing those dreams and those things, those physical things that you've always wanted to do, and you're getting it. We're gonna be with you every step of the way to make sure you keep accomplishing those goals, huh?
And I want to say thank you for always trying to do best and always trying to get better things for your clients, for your patients, so they could get better themselves. So thank you.
Thank you. That's very nice of you. That was great. Thanks.
Hi, Dr. Ed Tobenas here. I'm here with Jonathan. Hi. How you doing? Jonathan came to us with chronic ankle pain, some lower back pain, and neck pain he's had for years. I'm going to have him talk to you a little bit more about it now. We have a couple of questions here I was going to ask him, but I thank you for taking a couple of minutes to kind of talk to me about it. Okay?
No, you're welcome.
Thank you. Jonathan, what was the problem and how long were you suffering with it? What were your complaints when you came to the office?
Well, the leg, I did a major injury in 1973, and the nerves in the ankle, I had to go through therapy. That was in March of '73. I was released to go back to work in October of 1975. Did like a scissors the bones did, and it doubled back on itself. So like the nerves in the leg and the foot has never, it's like having a leg foot that's half asleep.
Yeah.
So I've had a lifetime of when I walk and you gotta be constantly knowing where your foot is, so you don't fall. Because you can't really tell. It's like if your hand's asleep, you try to pick up something, you gotta look at it to pick it up.
Right. And that's what you were feeling in the ankle.
And that's the way my ankle.
It's been for years. You were mentioning even just bending it was sitting on the computer or walking.
If I bend it up, it's like cramps up, and it's almost like I got like a metal vice that pressing against a bone, and when I walk, it's like it presses. And sometimes, like getting on my car, just going in the store is not if it's gonna hurt, it's how much it's gonna hurt, or how good the ankle's gonna do that day. A lot of times, just going to the store and coming back out, by the time I get to my car, it's like, oh my gosh,
Yeah, you didn't want it.
You just hurt.
Yeah, and I know looking at it, you had over the years, extensive amount of arthritis has built up in that ankle. Which was part of the big part of your pain.
Got rid of the pain.
If I walked to a curb and I would stop and
Yeah.
done this here, but I find myself doing this here sometimes.
Yeah.
And it's like, oh yeah, like I wouldn't have done that before.
Mhm,
So I'm
mhm.
not thinking of it, so that means the pain is not there. When pain goes, you don't realize it's gone until you realize you're doing things you didn't do before.
Well, yeah, sure. All right, awesome.
And do this here.
Can you stand right up on it? There you go. No pain?
No pain at all.